Punaka, namaste and good evening. Our show tonight focuses on the critical issues again that matter to the people of this country, matter to the nation as a whole. As we have continued to discuss that the contentious issues that matter to you will appear on Fiji Village Straight Talk. I'm Vijay Narayan, and we will continue to the people that can come forward and talk about things openly. Here on Straight Talk, we talk straight, we talk about issues that matter. We believe in accountability and transparency. We totally believe in media freedom and independence, and we want to ensure that the issues that matter to the people, they get the full details. So these shows also that you see, they go unedited, and it's live. Everything that is said, you get to hear about it. This week we are looking at the issue of HIV AIDS, sexually transmitted infections, teenage sex, teenage pregnancies, and a whole lot of issues surrounding that. So I'd like to welcome, on behalf of all of you, the people who have agreed to talk to us tonight. The Head of Family Health from the Ministry of Health, Dr. Rachel Devi. Thank you very much for availing yourself this evening.
Thank you for the opportunity, Vijay.
And also HIV advocate, survivor, and medical services specific counselor, Rebecca Kubunavanua. Vinavalevu for making your time to come this evening on Straight Talk.
Thank you, Vijay. Happy to be here.
A number of new HIV infections in Fiji has surged by a staggering 260% since 2010, making Fiji the second fastest growing epidemic in the Asia-Pacific region. A detailed analysis of the data reveals 245 new cases of HIV were diagnosed last year alone. That is the highest ever to be recorded in 1 year, indicating that new HIV infections are really on the rise in the country. And these are reported cases. You have sent in your questions. I'll take my time to go through some of your questions. We have also looked at the questions that matter, that need to be asked. We'll ask Dr. Rachel first. Dr. Rachel, what is the situation in Fiji when it comes to HIV and AIDS and sexually transmitted infections?
Thanks, Vijay. So when you look at the whole HIV situation, like you rightfully said, last year alone we had 245 cases, new individuals actually, and the previous year we had 151. So that's almost close to 100% increase. But having said that, remember HIV came into the picture into Fiji back in 1989, and we've had a gradual staggering number ever since. But obviously we've had the plateaus as well. But cumulatively, if you look at it from the individuals that were diagnosed in Fiji, we've had almost 1,657 individuals that we know that are currently living with HIV in Fiji or may have succumbed to it as well. Now, when you look at this information as a whole, predominantly we've seen, like for instance, just for 2022 alone, we had 43% between the ages of 20 to 29 and 28% between 30 to 39 years of age. And within this population, are almost 2.4% amongst the adolescents. And predominantly we've seen them between the age of 14, 15, 16 years of age. And that in itself is concerning. The young is rising. And if you noticed, within the statistics that we've got in the Asia-Pacific region, we're, I think, almost the second or third highest with the youngest population rising of HIV. And definitely that is a matter of concern, and which we as a ministry are responding to. And HIV is something that has been in Fiji for a bit, but one of the unfortunate things that happened in 2022, which we saw, was almost 100% rise in the number of deaths we've had. We had 46 individuals who unfortunately succumbed to this infection. And we're in this era we live in where we should not be seeing that. And because, we'll talk a lot about treatment and everything afterwards, but these are real facts and figures which we've been analyzing and we've been working with. And we found it very paramount that we release this data to the public as information to make that difference that we need to.
1,657 individuals, how many of them are still living with HIV?
Honestly speaking, as we speak right now, there are some that we don't know where they are. So some may have succumbed without us knowing as well. So that is one of our biggest challenge in terms of making sure that we have individuals stay with us in the clinics and we follow them through their lifetime. Because it's something we've come 30, 40 years down the lane, and treatment has made an immense difference. But I cannot definitely answer you in terms of how many are still living, but there is a good number that we have on treatment right now and being followed up in the clinics.
But your worry was that last year you had about 46 that succumbed to HIV.
Absolutely. I mean, even one death is too many. One death is too many. I mean, Rebecca can vouch for it. Like, one death is honestly too many. Because the thing in Fiji is government is committed to HIV treatment ever since we've had treatment in Fiji. Literally free for every individual that is HIV positive. So if there is treatment, I mean, if you talk about HIV as a disease, fine, it has associated stigma and discrimination associated to it. Well, depending. But if you look at it, HIV has come to a place where we talk about it like almost any other non-communicable disease, where once individuals are on treatment, they go on a lifetime of medications. Like, for example, if you become diabetic, apart from you controlling your diet and your necessary dose, you need to be on medications to control it.
One more question in relation to how much work have we done, and the main one being awareness campaigns. Definitely we can do more. It seems like we went to sleep.
I would say we can do significantly more, and that's one of the important things we're taking as these opportunities to reach out to the rest of the community of Fiji, especially the young. I mean, we've had different programs that was introduced. We do a lot of community work. We do university work as we speak, but we definitely need to leverage on all media outlets. I mean, if we could reach out for COVID to the rest of the whole of the nation and make a difference, and say similar can be done with HIV, I believe. So we definitely need to step up our game in terms of advocacy, prevention messages, and a number of campaigns that we really need to work on. And honestly, this is where I always advocate to media outlets. Let's work together. Let's get it out there.
Well, Rebecca, you're a person living with HIV, and our people need to understand the importance of how to deal with this situation. And as we say, we've come to a place where there's treatment available, and we'll talk about that as well. But we would like you to share your story on Fiji Village Straight Talk, as we discussed, on what happened in your case.
All right. Well, thank you. I was diagnosed way back in 2006, so it's now been 16. This will be my 17th year as a woman living with HIV. And I believe my daughter was a month old, my fourth child, which is the first of my two daughters. And so she was yes, a month old when my results had come back, and then I was called in because back then we had pre-test counseling and post-test counseling done to pregnant women. So this was this was back in Lautoka. And then so when that happened, I was called back in.
So you went for testing when you...
Yes,
pregnant.
It was voluntary. It was under
pregnant.
the voluntary confidential counseling and
right.
testing. Yes, that was done to pregnant women back then.
Right.
Yes, back in 2006. So I underwent that. And then, so when my results came back, my daughter was born already. She was already a month old. But then immediately, with a great medical team in Lautoka, everybody just took action. We did what we knew then was the right thing to do. The whole team, the medical team, and including myself. So I had been going through counseling. I didn't need to start on treatment back then immediately because they saw that I was still okay. I mean, yes, I had HIV, but I still could manage without treatment back then.
But when you got the test result on that day, what was your reaction?
Okay, yeah, that was, and something that I honestly still talk about and think about a lot today. And to this point where my children, to be very honest with you, my children sometimes feel that I favor this daughter of mine, because she was the one who kept me, focused. And right there and then, when my status was disclosed to me, I went with my daughter. She was in my arms, and she was my strength then. And we have a very close relationship. I haven't spoken about this in a while. Yeah, but to be very honest, blank. Just blank. What's going to happen? The first questions that came out of my mouth was, what's going to happen to my daughter? What's going to happen to me? How long do I have to live? Those honestly were the first questions that came out of my mouth. I mean, because back then, imagine the type of stories and the type of information that were, out there in the media, in the public about HIV and about AIDS back then. So that was the fear. But again, I go back to counseling. The importance of having counseling, and the importance of having a counselor with you when your status is disclosed to you. Because that just really, it just kind of got me thinking, okay. And so from then on, I spent literally almost the whole day with the team at this counseling center where my status was disclosed to me. And then something which I believe not many of my peers got to do was to disclose our status, or disclose my status to my family on the same day.
Okay.
Yeah, because that's what I did. That's what happened in my case.
So you after your discussions, then you went back to your family.
Yes.
And your family, you're talking about your nuclear family, your husband?
My mom. Because back then we lived with my mom and my dad, with my parents. But when I got home, my mom and my elder sister were the only two that were at home, and I was very confident to disclose immediately, because I knew, okay, I need help. I can't do this alone. I mean, that was just from me. Every story is different. That's what people also need to understand. That was from me. And the reason why I had I was courageous enough to do this on the very same day I was disclosed of my status was because I have a very supportive family. I have a very prayerful, supportive mom. And I have a very supportive sister. And, I just knew, okay, I could trust them. Unfortunately, not all stories will go this way, Vijay, but this is just a fact. This is how it went for me, and this is just truth of how it really went down. And so, I always consider myself one of the blessed ones in that sense, that I was able to let somebody else around me know. But it was not all roses after that as well, because there was always the continuous having that status known by only a few of us. It was just my mom, my sister, and the medical team, and my counselor, the continuous look-backs. Why is she looking at me? Why are they looking at me? Why? This went on for literally 2 years. 2 years until, yeah.
We're not trying to stigmatize the issue. What we're trying to do here, and that was what we're trying to achieve here, is to help people to understand as well. A lot of these situations, people put it down to, okay, it may happen to someone else. If someone is married, it's a protected relationship, that it wouldn't happen. If you can talk about that.
Yeah, well, let me put it this way. When I was in Form 6, we had people coming to our schools talking about HIV. I was amongst me and all my, my classmates and all. We laughed about it. And we were like, oh. And not until it happened to me. And not only did it happen to me because I was someone, I had a family. And to be very honest, something I love to share and talk about is that, especially this is something that we women need to talk about, because we know what our husbands or our partners do. We know some of them are just not very honest. Just sticking to one partner is just not on for some of them. But yet we turn a blind eye to this. And to be very honest, I would say I was one of that back then. And I talk about this because I don't want it happening to somebody else. I was in an abusive relationship. I was in a very violent relationship. And I just turned a blind eye to that, because at the back of my head, okay, I've got to have a good family, It's all about my children. But unfortunately, in the end, my children suffered. I suffered. So, irrespective, the fact that you have a family not only a family, you can even have a good job. You can even have everything. You can also even have nothing. HIV does not discriminate. HIV is not selective. It can happen to anyone.
It's irrespective of no individual.
Yeah, irrespective.
We'll get Dr. Rachel into the conversation because Dr. Rachel, fast forward a bit, in 2010 you became Rebecca's doctor.
Yes.
Yeah, absolutely. I mean, that's where my HIV space of career started. Is I went to the West and I worked with the team in the West, and she was one of my very few patients back then. And like in the Western Division, we started off with I think 10 individuals who were living with HIV there, but within the year that escalated. And honestly, that time, it like I mentioned, so much has changed about HIV that, like, I think Rebecca herself had kids who went through that PMTCT, the Prevention of Mother-to-Child Transmission program, and had negative children. And that's a value right now. I mean, that's so important. And last year alone, I forgot to mention, we had 4 newborn babies who came out to be positive. That's uncalled for. And we've got programs within right across the country that allows that if a pregnant woman is positive, they go through this program and the child can be negative.
We'll talk about testing, and you said voluntary testing was available back in 2006.
Yes.
Is it still available if you're pregnant and you go for your clinics?
Yes.
Absolutely. I mean, testing is available actually for the approximately 20,000 deliveries we do in a year. Testing is available for every individual one of them.
But isn't there an issue also that there's a lot of new mothers or mothers who get pregnant do not attend clinics?
That is one of the contributing factors. Like, apart from testing being made available, some would, like, we'd love individuals or women who are pregnant to turn up to the clinics in the first 3 months of pregnancy, at least to start that off. The first trimester, we say. That's the best time, and then we test them if they can't turn out positive. And it's not just HIV, but it goes to syphilis and hepatitis as well. And we go through them the necessary treatment. But we see a good number that either don't turn up, and these are usually seen amongst women who have a few children, because sometimes I guess it's the confidence that gets in, I should be fine and I can go to the clinic later. And we've actually had individuals, women who've walked into labor unbooked as well. So that has been contributing factors as well, and that can contribute to this sort of scenario.
So you're saying it's easy to get tested?
Absolutely.
When it's required, where can people go, those watching?
So for those watching, generally HIV test within the ministry, within public, private, both can walk into any clinic and ask for a HIV test. But we've got special clinics in the country that is in the Western, Central and Northern Division. It's a sexual reproductive health clinics, and it's very adolescent, youth friendly in the care places. In Lotoka, Suva in North, and basically almost in town, where they can just walk in, ask for a HIV test, and get a result soon after. And we are moving towards point of care testing now, where we're trying to make sure that, for example, if a person walks in to me, sees a medical doctor or a nurse, gets the test, and within the 20 minutes or so, they're likely to get a result back. So this is the point of care testing that the ministry is really moving towards. It's something that may not be done in private right now, but we are definitely ramping up these opportunities for individuals.
So with testing and with the issue going back to mothers who are leaving things late, or who may think it is okay, maybe I don't have it, or I'm in a relationship and we believe that it's okay and it shouldn't be an issue. What is your message from both of you?
To be very honest, the only message, the very important message I will relay out there is, I urge all pregnant women.
Actually, partners as well.
Yeah, and partners as well, of course.
Yeah. Well.
Definitely, I just urge you all, please come out, and as soon as you find out that you're pregnant, come into clinic, come in for antenatal, come and get a test. You never know what your partner has been doing. You never even know. Maybe your past, that can have a contributing factor to where you are today, but just come out and get a HIV test. We definitely and strongly encourage all pregnant women and have the support of your partners as well, so that you come out and get a HIV test. That is a very important part.
Dr. Rachel, is there a number that people can call if they want some direction before they go over? Are we looking at something like that?
We can definitely share numbers in due time. I guess we can definitely put that up. It can come up on our Ministry of Health page, which associates the clinics that we've got. But like I mentioned, Vijay, any individual can walk into any health facility in Fiji and ask for a HIV test. And honestly, without doing a test, you'll never be able to know your status. Absolutely never. I mean, this is such an important aspect to HIV itself, the HIV response in Fiji.
And sorry, if I just may add on to Dr. Rachel, besides getting into any clinic and doing a HIV test, it is confidential.
Yeah, absolutely.
It is confidential. That is a major part of it. This testing, it is confidential.
And apart from that, one thing I really want to emphasize on is don't just come in and get a test, come back or get that result.
Right.
There's a good number of individuals in Fiji who've gotten a test done, but unfortunately for some unforeseen reason haven't been able to walk back and get that result from the clinics. And obviously, I mean, anybody would go through that feeling that, okay, I'm going to get my HIV test. What if it turns out positive? But the reality of the matter is get tested, know your status. If it's positive, get into treatment. If it's negative, maintain that status. Those are some very essential, important messages, the public really needs to know. Because you can, like Rebecca said, HIV is a respecter of no person. A person with very good jobs can have it. Any other individual out there can have it. A young person can have it. So it's literally not a respecter of any individual or occupation itself. I mean, we've had situations where with people, for example, in nightclubs, people have turned to nightclubs and, have had unprotected sexual intercourse and not know their partners. Literally not know their partners.
What's the percentage? You telling me a very high percentage of people not knowing their partners? And
So basically, we did some analysis of the STIs and HIV cases in our clinics, and this was very in the early days. And when we did analysis, there's close to 40% that literally didn't know their partners. It was almost like that one night stand that individuals go in, and unfortunately, they're literally intoxicated with alcohol. And for sexual health, I think it's a blessing in disguise for the closure of nightclubs to come to 1 a.m. At least we know that, okay, you can go back to your safe space after that. But it's something that's really essential that, I mean, how can you be so face-off, not know your partner and indulge into something that's so special to individuals? But I think it's something that we really need to think about. And unprotected, not knowing your partner at all. So literally that person is going around spreading it to other individuals. We've historically, like just most recently in the last decade, we've actually done analysis where we've associated an individual to other 10 individuals whom they had transmitted this infection to. And this is reality on the ground. So if you look at what we're seeing right now, it could be just the tip of the iceberg. But the fact is, without testing, we don't know.
These multiple partners, you're saying one connected to 10, then getting the disease. What disease are we talking
HIV.
about? HIV.
Yes. You've had
a few cases like this?
We've had a number, we've had a good number of individuals who've had multiple partners whom we've linked individuals back to. Because we do this process of contact tracing. But like I mentioned, if you don't know your partner, how can we do that? And that becomes very difficult for the clinics, for the team on the ground to do anything about it. So that in itself is a challenge for us.
You're watching Fiji Village Straight Talk. I'm Vijay Narayan. We'll be back after this break. About 20 years ago, we had a major drug bust, and you would remember, you would have been part of the operations at Laudala Beach. A lot of people in Fiji did not know what was methamphetamine. And what we are picking up on, people are saying it's readily available. Just the issue in relation to General Secretary, was that a tactical move that he ejected himself from Parliament?
Personally, it's unfortunate.
How are you dealing with those police officers who may be allegedly involved in this?
Vijay, no one is above the law. We assure you that we will be having police officers around.
Super Rugby is not an easy competition to compete in. Success doesn't just happen overnight.
Bulavinaka, I am Vijay Narayan. This is Fiji Village Straight Talk.
Fiji Village Straight Talk with Vijay Narayan, brought to you by Kasabias, specializing in your need.
You're watching Fiji Village Straight Talk. I'm Vijay Narayan. Our guest tonight, Dr. Rachel Devi and Rebecca Kubunavanua. We're talking about HIV, teenage pregnancies, sexually transmitted infections, unprotected sex. Let's go back there and talk about, you're saying almost half of the people who are getting sexually transmitted infections do not know their partner, and they were drunk in the process. What is that data coming through and clearly indicating that is rising or continues to be the case?
One thing is factual is we do need to go back and do more analysis on this for sure. But that is something that we saw a trend of, and when we were in the clinics, we've been seeing that, and it's definitely something that's prominent.
Does that concern you, Rebecca, that this is becoming a normal thing now, that almost half of the people getting some sort of sexually transmitted infection do not even know who they slept with?
It is a big concern. It is a big concern because as it is from a PLHIV, a person living with HIV's perspective, we have also established a local network known as FGN Plus. Okay, and we support the ministry and our stakeholders and our partners in even trying to get those who are lost to follow up, like Dr. Rachel had earlier mentioned, are lost to follow up in treatment and all that. Yeah, while still trying to get this in, and our numbers continue to increase. Of course, this is for us. We're shocked. We're stunned. We know what we're doing on the ground, but it had been mentioned earlier, we had quietened down a bit, and unfortunately, to an extent where we believe. And I have personally heard people say, HIV is no more, and to them that's it. So they're free to do as they please. So it is a worry because that behavior is what's been happening out there. That is, and when I say behavior, I mean sexual behavior, sexual activities, all that has been happening out there. And that was what is causing the increase and the rise in the numbers of HIV infection. That is what we have tabled out here today by Dr. Rachel.
There's a lot of questions that have come in, and we're looking at the reported HIV cases, and it's alarming. But people are talking about, what about the unreported cases? What's your analysis on that?
No, that's factual. Well, we do estimations. We do HIV estimations with the UNAIDS year in, year out, and obviously they do give us projections, which depict similar projections. But having said that, if you consider the 1:10 individuals that an individual could infect, and you multiply that by that number, for example, last year alone, if it is 255, I mean, it's just a proxy, I must say, it's just a proxy. But if you multiply that by 10 itself, and with this behavior, you can estimate that to be close to more than 2,000 individuals out there.
In a year?
Yeah, in a year, possibly. But see, remember one thing, an individual, for example, out of the 245 individuals, we don't know when they got that infection. So you can never predict, okay, was it last year? Was it 4 years ago? Was it 5 years ago? Was it 6 years ago? We can never really predict that. But from the numbers that we know, but obviously we do know that we're testing them in the hospitals, they're coming out sick, and unfortunately either in the AIDS stage or in the later stages of HIV. So this is important. But the predictor could be a number of things. But from the estimations we're seeing, we definitely are seeing more than the 245 and escalating. But if you look at the predictor as well for 10 by 10, you can look at those numbers.
More than 10,000.
I mean, yeah.
Now, we're looking at the high level of unprotected sex in the country. There's questions being raised. Why there is unprotected sex? Is it because of access to condoms, or is it because people want to be rebellious, or is it because of lack of knowing that if I don't use contraception, I will fall into maybe the issue of transmitted infections, but on top of that maybe also getting pregnant and not understanding it fully. We've heard a lot of stories of young girls getting pregnant and even then saying, I don't want this child, or leaving a child somewhere. What are we getting as far as unprotected sex is concerned for Fiji?
Well, in terms of, for example, what you're sharing in terms of like access. Now, when you look at condom distribution right across the nation, this is something that's, well, available in all health facilities in our reproductive health space, but even open, available in public spaces within the health facilities. We've even had opportunities and programs where we've had condom dispensers placed in public toilets in the city of Suva. But, you know, there are challenges that we also tend to face. And obviously replenishing them is a challenge. And, you know, getting that access out there. And obviously, you know, individuals, the other thing is having it in your pocket doesn't mean you're going to end up using it. But using is another aspect of it. So there's a lot that goes around it. But that unprotected aspect is. But having said that, Vijay, being mindful, HIV is not just spread by. It's not just a sexual issue. It's more than that. It's obviously the tattoos, injectable drug use. It's got to obviously do with the mother-to-child transmission. It's even with, for example, with sporting activities. If an individual has an injury and is bleeding, and for some unknown reason was positive, and the other person on the other end has a cut or an exposure in the skin and gets exposed to that blood, that's fresh blood. So, I mean, we have to be mindful that it's not just a sexual aspect. It's more than that. And that's important to know.
The highest level or highest level of cases come from sexual contact?
Yes, likely. That's one of the most prominent ones.
With unprotected sex, you are out on the ground doing advocacy work. What are you picking up on?
Well, unprotected sex, I mean, we're doing our part, like Dr. Rachel had said, condom distributions, we're doing all this, we're giving it out. And to be very honest, there are many times when we go out into the communities, we distribute condoms and we see how they joke about it, we see how they laugh about it. You know, it's a joke because it is a taboo. It is a taboo issue. Coming back to sex in general, talking about it is just a big taboo. And so we are there on the ground and we are encouraging and engaging parents and children to start talking about it. And for me personally, I begin from home. I talk about sex from home. And I share this when I go out into the community, because I can't be going out into the community and telling the people in the community, you know, condoms is available, sex and all this, yet I'm not doing it at home. So that's where I begin. And to be honest, well, like I've got 5 children. And I have my children who openly talk about sex, you know. We talk about it, we joke about it, but the educational part about it is stuck there because it's an ongoing thing. It never used to be a topic in our homes, and this is what we encourage parents to start talking about in their homes. You know, like we've just told them straight out, please, enough of pushing it under the table. We've got to bring it to the top of the table. We've got to sit around the table and talk about it because it's happening, and if we don't address it, then it's our children who are going to suffer.
Teenage pregnancies, that's going to that. You have statistics, I believe, that you have analyzed. How are we looking at those stats now compared to maybe 5 years ago?
Well, Vijay, when you look at 2022 alone, we had close to about 956 teenage pregnancies. But when you look at the last 5 years, they're close to about 5,107 teenagers between the age of 13 to 19 years who are pregnant. But having said that, it's been almost staggering on a gradual, but approximately 1,000 almost in the last 5 years. And per year, yes, approximately 1,000 a year. But having said that, in 2021, during the lockdowns, it was half that number. I think it was around 586 or so individual teenage pregnancies during the lockdown period. So and predominantly we have seen it in the Central Division, and that's basically what's been happening in terms of teenage pregnancy itself. And I must tell you, it may not be something that they are all school students. It could be out of school students as well, dropouts. So there could be, or even dropouts contributed because of teenage pregnancy, though. So that is the level of data we do not have right now, but approximately 1,000 a year has been the usual trend in the last.
Based on the records, are you seeing young people getting into sex at a much earlier age? What are you seeing?
Look, from the clinical perspective, we've seen very young individuals, because we, as a medical doctor, we do a lot of history taking. And when we talk about that, we do talk about first sexual encounter. And some go as young as 10, 11 years of age and 12 years of age, obviously. But I think the youngest I've ever come across in my medical practice was 10. So we have seen that young exposure, yes.
How are you dealing with that on the ground with the younger people who you need to educate?
Yeah, well, like Dr. Rachel had just mentioned, like I work from MSP, Medical Services Specific, and we work very closely with the sexual offense unit from the police department. And we have children brought in, young girls, like she said, 10, 12, 11, 12, and so on, who are active, sexually active, sexually active. And it all goes back to, like we said, like, what are we doing about it? What are we as parents doing about it? Like I said, we are doing our work, but we know it's not enough. And now that the results of not enough is right in our face right now, as you can see, 1,657. So that is an indication for us, like we need to up this game again, and this game meaning, our awareness, our outreaches. We need to do it. We have been doing it, but right now, to be very honest, and as we were discussing this afternoon, Dr. Rachel and I, before we walked in, we need to up this again. We need to get back on top and begin again from where we were, because we want to get back to where we had been in 2015, 2014, which is, almost, but we knew we were getting somewhere with our awareness, because people were actually talking about it. People were actually, doing things, but now it's just all going down again.
Is funding an issue?
So, look, Vijay, one of the things was when HIV started globally, including Fiji, we had a good response from Global Fund. I mean, there was a response fund, there was other UN agencies, etc. But recently, with numbers going down, I think, obviously, and our Fiji became an upper middle income country, we couldn't be eligible for Global Fund. But having said that, in 2024, we are getting into the Global Fund grant again. And the government has upped its budget from last year, to close to 200,000 this year for HIV alone, and obviously for adolescent health has gone up significantly, close to 200,000 itself. So there is funding and there is opportunities to get more funding, and this is just programmatic funding to go up. But having said that, this is separate budget. There's a separate budget as well, which our pharmaceuticals team look after for the medications and the reagents that we buy for testing. And basically the testing and the treatment is totally a separate budget as well. And it's a commitment that the government has made for a rather long time. So what budget I'm talking about is basically solely programmatic budget in terms of going out. And obviously the other thing is we've got our partners like REF, MSP, other PLHIV group organizations, and even LGBTQI organizations that really work with us, and they've got their sources of funding within the organizations. And obviously there's a number of different programs that happen through different
There's some questions came through, and we also will be speaking to UNAIDS. The UNAIDS has also sent out alarm bells that based on Fiji statistics, the questions being raised on whether UNAIDS is staying on in Fiji. There's some questions about whether they are downgrading their operations and moving away from here. Is there some indication of that?
So basically the UNAIDS was a big office at one point in time, a massive office with a lot of people. But in the last 5-6 years or so, I believe we've had only one few people in there. And in the last year or so, just the country director. But I believe, well, I'm not sure, UNAIDS can probably definitely affirm that. But having said that, they briefly heard that that position could come under the resident coordinator. And this is where, like, I believe the UN agencies can really help us. Because the other thing is the technical support, unfortunately, has also been lost through our UN partners in terms of WHO, UNICEF, but we really need to ramp that up.
You said the office was much bigger. Maybe we need the ramp up now, because it seems like, well, we are being compared to the Asia Pacific region.
Yes.
Absolutely.
Yes.
And that's horrifying.
Yes.
And if people like who sit up at the UN agencies, and don't you think they should take notice of this? Not just showing the stats, but I mean, you come from the advocate area, and you come from, we need more support. Don't you think more needs to be done?
I mean, definitely for like technical support, and with that comes other resources as well. And obviously there's strong monitoring, evaluation that and even communications aspect of it that comes about. So yeah, I mean, one of the biggest and the benefit that the country has, Fiji has in the Pacific, is that these offices are just based out in Fiji itself. So that and that added support will definitely significantly boost the response.
We'll be reaching out to UNAIDS. We've got a discussion pending with them, and I must say that we will be also speaking on the effective use of UN funds in programs that are meant for Fiji and how they are being used, and that'll be a discussion, a wider discussion that needs to take place. The other issue is comprehensive sex education or family life education in schools. I received some feedback from people. They're saying that it seems like it's no longer happening in schools, and these are from parents. They've said that they've asked their children, and we would like to know where we're sitting in relation to that, because at one stage there was a big push to ensure we have sex education in school and appropriate material as well to ensure that matches the curriculum for students to understand. What is happening in that area, Dr. Rachel?
That's a pretty good question, but in terms of exactly what's happening in the education sector is something that probably they will be able to comprehensively tell us about. But having said that, we do know we've had comprehensive sexual education which started at primary school, and they are different phases of it. I know even previously we've had backlash where parents would say, don't teach my child sex. I mean, you know, and you're promoting sex, but that's not the reality. It's about teaching them the right and the wrong, and obviously you need to know your body as a male and a female. So those things were something that our peer educators in the ministry started off from the very primary school days and build up. But having said that, I have heard from teachers, students that has dwindled down a little bit. But having said that, currently we are working with the Ministry of Education. We have a family life education program that's been reviewed, and Ministry of Health is supporting that process. It's been reviewed through the support of UNFPA, and that is definitely one of the important program highlights with education and health and UNFPA. And also, obviously, it's almost based like an in school and out of school. For in school, we work with education. For out of school, we work with the Ministry of Youth and Sports on this one. But this is something that we're definitely reviewing and will definitely be addressing.
Rebecca, how important is this comprehensive sex education from the school system?
Well, personally, I feel it is very important, and it's got to go on. One of the issues that, having worked with the stakeholders and all, one of the things that we hear is an issue is because, again, going back to sex being a taboo issue and something that is really spoken about, most of our teachers out there, when it comes to talking about sex to the children, they can't even talk about sex because it's still to them in the back of their heads a taboo thing. So, it's got to start from the institution, from when they're taking in these teachers at unis, at FNU and all these places. They've got to start, beginning to talk openly about sex to these students who want to go out and be teachers, to make it effective, to make it also very effective. And just on that note, like I had mentioned, how I openly talk about sex and all with my children at home. I have my youngest daughter, she comes home and she said, "Oh, Mommy, we spoke about sex and HIV today." "Really? And what did you speak about?" The teacher asked, "Hands up if you have seen someone living with HIV." She lifts up her hand. "Hands up if you know someone living with HIV." She lifts up her hand. But the teacher knows that I am positive. And then they ask her to come and talk about it, and she does. My mom's living with HIV. She contracted it from my dad, and my dad has passed away. And so she is, and she gets to explain and tell about me. And the same with my other daughter. My second daughter as well. She stands up boldly because we talk about sex at home. Goes back to being, from home. Because we talk openly about sex at home. When it comes to school and the issue and talk on sex, she'll talk about it openly with her peers, her classmates, and it's because the knowledge is there, the right information is given, and this is what we want. School is the second place where they learn about it. Home is the first place they should learn about it.
That's the way to go. That home is where things should start, and not that the fingers should be pointing outwards,
Exactly.
but first starting from home and then outwards in trying to ensure that the school is doing enough, the government is doing enough, the community is doing enough. We'll be back after this break. About 20 years ago, we had a major drug bust, and you would remember, you would have been part of the operations at Laudala Beach. A lot of people in Fiji did not know what was methamphetamine. And what we are picking up on, people are saying it's readily available. Just the issue in relation to General Secretary, was that a tactical move that he ejected himself from Parliament?
Personally, it's unfortunate.
How are you dealing with those police officers who may be allegedly involved in this?
No one is above the law.
We assure you that we will be having police officers around.
Super Rugby is not an easy competition to compete in. Success doesn't just happen overnight.
Bulavinaka, I am Vijay Narayan. This is Fiji Village Straight Talk.
Fiji Village Straight Talk with Vijay Narayan, brought to you by Kasabias, specializing in your need.
Welcome back. You're watching Fiji Village Straight Talk. I'm Vijay Narayan, and we are speaking to Dr. Rachel Devi and Rebecca Kubunavanua, talking about HIV, a whole lot of issues surrounding sexually transmitted infections, teenage pregnancies, unprotected sex. There's another issue that is really prominent, and you did go in there in relation to, it's not just about sex and unprotected sex which leads to HIV. We have a growing concern regarding the high usage of hard drugs in the country. Young people using it, a high rate of intravenous usage, the sharing of needles, all confirmed in our show about 2 weeks ago with the Drug-Free World Fiji founder Kalesi Volatambu. They've gone through about 120,000 direct consultations with people in the country, and what's coming out very clearly, even students, syringes found in their bags, the concerning issue of intravenous usage and sharing of needles. Dr. Rachel, you would be very concerned.
Absolutely. I mean, this is something that we definitely wouldn't want in a country like Fiji, especially with high HIV numbers. And one of the things you can definitely equate to is probably this is something that's contributing to the numbers in itself in the last few years. Because injectable drug use, if individuals are doing that, sharing of needles is the very last thing you really want to do. And because that transmits HIV in itself. And if it's multiple individuals, any one of them is HIV positive, that's immediate transmission, because that's direct into the intravenous. So that is definitely. And having said that, Vijay, last year in 2022 itself, we know that there were 3 individuals we probably suspect who are injectable drug users who contracted HIV, and there could have been more. We're not sure, but from the history taking, the investigations that we did with the individuals, we did pick up possible 3 cases, and possibly more there.
You're watching Fiji Village Straight Talk. I'm Vijay Narayan, and the other issue that has come through quite a lot is in relation to babies and women getting pregnant. One of the issues, Rebecca, you highlighted about treatment and your children being negative due to the treatment, the antiretroviral treatment that is available. The other issue now combined with this is the drug taking, the hard drugs, and babies born, the dangers associated with mothers who are pregnant and are heavy hard drug users, which is becoming an issue in Fiji now. It is staring down into our face. What can be done for both of you?
Look, just that within pregnant women in itself is a big harm to the child and obviously the mother to start off with, because with the mother carrying the child, that calls for a number of things, and we know that because of alcohol, because of drugs, a child can be born premature, a child can probably die in their womb. So that in itself is there. But one of the things I'd really encourage women to do is, the moment you do realize you're pregnant, I mean, that is something that you need to do, is refrain from all these things. Refrain from the alcohol, refrain from this drug use. Let that wane off and let you have a child, I mean, that you know that is born normal, like rather than having a congenital anomaly because of what these illicit drugs do to an individual. So those things are absolutely essential. And having said that, we do see a number of babies born prematurely because of HIV, STIs, sexually transmitted infections mainly. So I think that's something that we really need to encourage all women out there to make sure that they do justice to that pregnancy.
Rebecca.
Yeah, just adding on would be like, when we're speaking of women who engaging in such risky behaviors, most of the time it all comes back to that, STIs and HIV. And yes, we have been hearing, and of course in general, the public have been hearing, treatment is available. If you're tested positive, treatment is available. But there's a whole lot more to just the fact that treatment is available. It's about taking treatment adherence, taking your treatment every day at one exact initial time to ensure that the drugs get to work inside of you. Are you able to do that? It's a lifetime commitment. It's also about the side effects that come along with taking this treatment. And then if you're also doing drugs, hard drugs, you have your down days. You have the same with this treatment as well. Are you prepared for all of this? Are you financially capable to take yourself to the clinics and back every month? You, your child, for your clinics, for all of that. All this has to also be considered by the mothers, by the parents. That's why we again go back to encouraging mothers, all moms in general. Once you know you're pregnant, please go off to the antenatal clinic and go and get your booking done. That is the only way you can get your test done and you can get to know about your health, your status, as well as your child.
Now on our show we will also be speaking to other connected people, as we've said that we will be talking to others. We've said about Ministry of Education. The other group that we will be looking at is the church groups and how much work is going on with the church groups, and you mentioned some of the NGOs, but church groups, how much work is going on there?
Thanks, Vijay. I mean, I think that's a very important group that we really work with, and we've been working with the church groups for quite a long time. I mean, I've spoken, I'm presuming Rebecca and my team, like on the ground, a lot of them have been, almost all of us have been invited to all these faith-based organizations, I'd say, not just church groups, like all faith-based organizations to talk about this amongst the youth, especially the youth camps, clubs, etc. So that is something that we do openly talk about. We do share statistics, we do share HIV, STI issues, prevention measures, and obviously we definitely respect the fact that if religious organizations are saying abstinence, so let's talk about abstinence. But obviously there's other options as well. But religious organizations play a huge role, Vijay, in this. And having said that, with UNAIDS, the ministry, we did develop a strategic plan which worked with religious groups. So we literally need to pick that up again and run with it again and ramp it up again. Like I said, we literally need to step our pace and the way we respond to things and get everybody on board. And I must applaud, faith-based organizations that have already come on board and like have publicly said that we need to do something about it. And as soon as the stats came out, so they are keen. We've worked with them, and I know they will continue to work with us.
You're watching Fiji Village Straight Talk. I'm Vijay Narayan, and another issue that people have been raising is the issue about stigma, discrimination, and the mental torture, if you may like it, that comes with if someone has got challenges in relation to HIV and sexually transmitted infections. Rebecca, if you can talk about that to people and how we can handle those things better.
When it comes to stigma and discrimination, one of the things that that actually comes out very strongly is that, like I had mentioned at the very beginning, every person living with HIV, their story is very different. So the level of stigma and discrimination someone encounters is also very different. On a personal note, for me, there was a whole lot more of stigma than there was of discrimination. However, we fought to ensure that there was no discrimination done to all our peers in general. And when I say we fought, we made a lot of noise. We went out there and we put we put our face to the name. Say like, we're talking about treatment. We're talking about HIV. And here we are, as people living with HIV, we're trying to tell everyone, if you go on treatment, if you go on, if you adhere to treatment, like I'd been speaking of earlier on, this is the result. And when people see you like this, and also your behavior, to be very honest, your behavior is a big contributing factor to this. So it's also how we behave, and it's, and everyone is different, coming back to that, everyone is different. And then another important component in all of this is counseling. And counseling, like I'd mentioned, I went through counseling. I have a very supportive family. I went through counseling. And because of that, the support from the family and counseling, it's where I am today. And it stays, and I have become so passionate that I have myself become a counselor to do the same to my peers. So when they're diagnosed, I'm there for them. If they're willing to speak to a positive person, I'm there for them, because that's what I went through. I had counseling. I spoke to a positive person who was also in that field at that time, and here we are today. So, this is something that I want to strongly emphasize, that there is counseling available. Make use of the counselors. Fiji may be small, and the fear is, if I share my story, if I tell this person will know someone that I know and will tell them. No, when it comes to counseling, it's confidential. And we have a lot of counselors, and it does not have to be within the medical facilities. We've got many outside. Our stakeholders, our partners, MSP, we are one of those stakeholders, along with many others that provide these services.
Dr. Rachel?
Vijay, there's one thing that has changed. In my opinion, for example, when I'd walk into a ward in the hospitals, as soon as they know Dr. Rachel's there, the HIV doctor's there. So that patient is likely a HIV patient. But those things have changed now. So while a number of that has changed, we still do have stigma and discrimination on the ground. And sometimes, while Rebecca was sharing, sometimes we have seen individuals who are HIV positive have self-induced stigma. Because they think, what will the other person think of me? Whereas on the other side, the other person is actually willing to help them. I think there's a lot more susceptibility, but we still need to do a lot of work around it. I mean, I think that's of important information because we, in order for us, an individual HIV individual to come out, they need to get out of that shell. It's not easy, but knowing that there's that support net, and there are individuals who confide in individuals. So I think that is something that's essential for every HIV patient living out there.
So it's clear the clock is ticking for us. We've got massive increases in reported cases. We are unsure about unreported cases. We've got increasing use of intravenous uses, hard drug use. We have got people having access to syringes and needles, and that's a big question there, how they manage to get this. And we then have unprotected sex, which has increased, and we have people who almost half of the population, or half of the people rather, who you, based on the data analyzed, who have had sexually transmitted infections, do not know who they slept with and do not know who passed it on to them. With these issues at play, and then you're saying that taboo remains, from you as an advocate first, and from you, Dr. Rachel, from MOH perspective, what needs to be done now? And you can speak directly to the people who are watching.
Well, for me personally, as a person living with HIV, this is a time where we, people living with HIV out here, would like to call on all our stakeholders, on all our donors. We need your support, especially when we have an established organization for people living with HIV out here, known as Fiji Network Plus, because we have seen how effective our involvement has been in terms of PLHIV intervention and meaningful involvement, and we would like to bring this back up. We would like to get back up there, and so we are seeking your support from our donors, from our partners, and of course we have this well-established support already with the ministry, and yes, we just got to get a few things to place. All we are asking is that you continue to support us, PLHIV, so that we can also be the voices and faces of people living with HIV out there in two things: in getting those of our lost to follow-up cases to come in for treatment. We have spoken about it, treatment is available, and this is why we want us to be back out there, so that we can bring in these ones, and also that we can ensure that this behavior that is becoming a trend right now, that is continuing to make this rise and increase in our status, in our numbers of HIV cases, non-cases, we want to just maintain this. We just want to keep it at this now, so that we ensure that people are coming in for treatment, people are coming in for testing, and to ensure that behavior changes. Those are the three things that we, our PLHIV, would love to see the support from the public and from our donors.
Dr. Rachel.
Thanks, Vijay. I mean, as a nation, we can do a lot, like a lot. And as a medical doctor who's worked in the field of HIV for the past 10, 14 years, it's something that we need to do as a team. And honestly, knowing your status is absolutely important as an individual, especially if you've indulged into unsafe sexual behaviors, you've had multiple sexual partners, and getting that one test. For example, I'll give you a typical example. You can never differentiate a HIV patient from a diabetic, TB, or even a cancer individual. How can you? How do you differentiate them? The only way is by getting yourself tested, especially if you have involved yourself into those unsafe sexual practices. And apart from that, obviously, prevention is key. And, step up, do the preventative measures that you can as an individual, as a youth, And not just yourself, but talk to the other individuals, your friends, amongst your peers. Talk about it. Know the right information and not just any information that's available out there. Don't take it at face value, but do what's right. And, as I believe, Vijay, if every individual in Fiji steps up to just fight that campaign, know your status, we can curb this in a matter of no time. So I think it's a challenge out there to all of us. While we step up, I think as a team, we need to do this collaboratively. I mean, I can't do this alone. Rebecca can't do this alone. The Ministry of Health can't do this alone. NGOs, faith-based organizations can't do this alone. We can give it to individuals, but the response is theirs. Health is an individual response, and I think that is absolutely essential for us as a nation. And I think I call on that, like just that challenge to know your individual status out there. Thank you.
That's Dr. Rachel Devi and Rebecca Kubunavanua, and that's the show for tonight. Next week, we have the second episode of the reality of the situation on the ground as far as hard drugs and substance abuse is concerned, and that will be airing on Fiji Village Straight Talk, and that will be a number of people again coming forward to talk straight to the people, to try to make a difference based on the growing problem that is happening on our ground. Until next week, have a great evening.